Thank you. Thank you for that warm welcome. Hello, everyone. I feel honored and humbled to get to speak on the investments that we've made in Sonoma County specifically and the results that our nonprofit partners have executed on. So, this talk today will be really focused on how we listened to community and then the impact that those frontline nonprofits have made. And Kaiser Permanente is just a civic partner. We're a business, a health plan, a nonprofit. We're not a foundation. And so this is just one way that business partners can show up and support in the recovery. So, just a little bit about me. So, I'm Sonoma County homegrown. This is my community. And when the Tubbs fire happened, it did start in Napa County. It, of course, impacted Lake County as well. But the biggest impacts were right here in Sonoma County and specifically in Santa Rosa. And those fires burned devastated homes within a mile and a half of my home while my family was sleeping, my little children, my husband and I. And the picture that you can see there on the slide is actually the fire burning right up against our hospital, our KP Santa Rosa hospital. And so that is an image taken from one of our windows of the hospital. And while we safely evacuated the patients in the hospital that night, over 200 of our physicians and employees lost their homes. Many of them lost their pets. And Judy Coffey, who was just mentioned, she was the senior vice president area manager at the time. She lost her home that night when she was evacuating the hospital. And then, personally, I also had a family friend perish in the fires. So it's very personal to me. It's a huge honor to get to talk about this. And just I'll go to my next slide here. So in Sonoma County, that Tubbs fire was the first, and at the time, it was the largest disaster in the state of California. Of course, there have been far worse since then, unfortunately. But then we were struck by multiple additional fires and a nationally declared flood. So you can see in this image that 27% of our open space, our land, has been fire impacted. So, what I'm really here mostly to talk about is the 5-year strategy that we stood up. And I was really fortunate to get to be on that team to develop the strategy. We are a national organization. So, when the fires happened, the late Bernard Tyson, who was our president and CEO, came immediately to meet with Judy Coffey, as did Bashar Shakir. He is the chief health officer currently still he's a national executive. They came, they got eyes on the need, and they made a commitment right there to stand up a 5-year strategy. So when I came into the organization, I had the opportunity to help develop that. And you can see 65 organizations have been funded, and the result of that was just under 24 million. And again, we're a nonprofit health system, so we're not a foundation, but we do feel like we have a social responsibility to show up and support the community and to really listen to the needs of the community. So we landed on four kind of pillars for our disaster response. First one being economic security. And so, in thinking about that, of course, we were wanting to meet immediate needs. So, we participated in a lot of resourcing around that. But we were also looking at what might we invest in that was more of a long term impact in economic security. And some of that had to do with workforce pipeline. And then for mental health and resilience, we had a big focus early on crisis response and then later on scaling up the capacity of nonprofits, community-based organizations providing mental health in the schools, in community, in languages other than English. And then for housing stability, we were very concerned about gentrification through the fires. We know that a huge amount of our renters were fire impacted. We had 5% of our housing lost overnight, and we're already having pretty extreme housing shortages. And so for us, we focused on affordable housing, workforce housing, but also shifting our mindset when we think about housing preservation and actually defining affordable housing rebuild as part of that preservation strategy. And I'll talk a little bit more about what I mean by that in a later slide. And then we were looking at community infrastructure. So as we rebuild, we have this opportunity to think about populations living on the margins, people who were really not always the voice at the table and should be, who had been systemically been impacted by racism and had been experiencing redlining and things that had impacted their family's ability to get the leg up and have financial stability. So, in the community infrastructure space, we focus not just on fire hardening and disaster preparedness, which were both priority areas, but also how the city develops their general plan. And could they hire a equity planner and have somebody in that role that was completely focused on that? And so, one of the things we did is we funded the first 3 years of the City of Santa Rosa's at first ever health equity planner. And that person had a master's in public health from UC Berkeley, a master's in city planning, speaks Spanish, English, and a Guatemalan dialect. So these people are out there. It's just sometimes it takes the resourcing and the commitment to that to incorporate that into the planning. So now I get to just spotlight these amazing nonprofits that are in this community. One of the things that we learned from listening to the community is that there was this significant secondary impact on renters who did not lose their homes in the fire, but because 27% of fair market rent had jumped, they were suddenly facing housing insecurity. Two things were happening. One was people who were in these wealthier areas of Santa Rosa that lost their homes suddenly became renters, and they could pay rent at a much higher rate than our existing rental market. They also had really high level jobs, and so they're very desirable on an application. So we heard quickly from community that there was a lot of unjust evictions occurring. So we invested in Sonoma County Legal Aid. They're an amazing nonprofit in this community. We're so lucky to have them, and they executed on protecting people from unjust evictions. And the work that they did then also informed their COVID strategy and how they protected people through the pandemic. So we feel very grateful that that organization is here. We also partnered with Undocumented. There are over 35,000 undocumented community members in Sonoma County. I'm sure there's far more. That's the number that we have a count for. We're an agricultural community. So UndocuFund was really essential. We had a lot of agricultural workers that were jobless when this all happened because work was frozen. The fires were going for a number of days. And that UndocuFund ensured that dollars got to the right people through a trusted source. And then we also participated in a pooled fund. And I know yesterday's panel, the philanthropy group that spoke, and they're amazing. They're also doing those pooled funds, like in Maui, KP's partnering with that. In Sonoma County, it was through Community Action Partnership and the Sonoma County Community Foundation, United Way of the Wine Country. Same thing, we came together to pool dollars and get the funds out to the people that needed them most. And then in the mental health space, our first big grant, $1 million to the County of Sonoma, was focused on crisis response. They served over 24,000 people with that immediate response. And then we also scaled up community-based nonprofits like Humanidad and SOS Counseling, Alliance Medical Center to provide community-based mental health services. So, in the housing space, one of the most exciting things that we participated in was the launch of the RED, the Renewal Enterprise District. And that was a joint powers of authority between the city of Santa Rosa and the county of Sonoma. And they approached us and asked, might we fund their feasibility study? Could this RED, this Renewal Enterprise District that funds rebuild, rapid rebuild, and infill and smart housing be feasible in Sonoma County? So we funded that study first. The study was published. They decided, yes, we can launch the RED. They drew down $20 million in PG&E settlement dollars for the fund, but they didn't have the staffing funding. So we came back with $1 million to fund the first 3 years of the staffing for the RED so they could execute on that fund. And what's amazing about that is that today it's a revolving loan fund and it's paying itself back. And they have over 1,500 units that people are living in today, keys in hand, due to some of these investments. The other investment was with the Santa Rosa Metro Chamber. They also have a revolving loan fund and participated in expediting these rebuilds that I'm mentioning. I would be remiss if I didn't mention the Caritas Center. That's Catholic Charities' big homeless shelter in town. I know Jenny Lynn Holmes, the CEO, was here yesterday. just a visionary around homelessness, and we participated in helping expedite the build of that as well. Um, on the infrastructure side, Coffee Park was one of our partnerships, and I'll talk a little bit about that later. We helped rebuild that as well as Foothill Regional Park. And then the two images on the right, we have Lideres Campesinas and Nuestra Comunidad that did the Listos program. Both of those are organizations that are doing work statewide, but a lot of that work started here, was rooted in community. It's in Spanish or in other indigenous dialects, and helping people be prepared at home. So, really, again, lifting voices of community, in reach, scaling organizations that are already trusted has been a big focus of our equity agenda. So that's Coffee Park before and after, and I know, Councilmember Okrepke's on the next panel, and he'll be probably speaking a bit about that. And then, in that disaster philanthropy work group that was mentioned in my intro, I have the great honor to be one of many of us that are on that work group. And I think the big takeaway here is that we do have a national focus that is standardized, in addition to the piece that we do that is very much rooted in community. And so it's what you would expect. We're partnering with the American Red Cross, making sure that funds get out to the community quickly. In-kind donations, both of medical supplies, refilling prescriptions, our workforce getting out and volunteering at these evacuation centers. And when we say workforce, we're talking physicians, nurses, pharmacists, interpretive services, you name it, we pretty much have those roles. And then we have a robust employee giving campaign. So that's just a picture from Lahaina when they were distributing food bags and really being right on the ground in community. And then I just wanted to give a couple highlights from my colleagues in the other service areas. So this slide is from KP Maui. And what you can see here is their 2 years. So they just had their 2-year anniversary since their fire. I know we have a bunch of a Maui team folks here today. And they were very much focused on first supporting those emergency response organizations. Our Lahaina clinic did burn. So then we implemented our mobile clinics and brought those out into the community. Helping people stay covered was our big win in this county. So what we did is, for one, we paused the health insurance premium. So if people did not have the resources to pay their premium, we said that's okay. We'll continue to cover you for free. So that was number one. The other thing that we did is we offered medical financial assistance to non-KP members in the area. The third thing that they did is they established a charitable healthcare coverage plan and extended free health insurance to many people who had never had health insurance before. First time ever coming in, getting their preventative medicine, getting their eyes checked, their ears checked, basic health needs. They were able to expand coverage for. So I feel really personally honored to get to speak about that, although that work was not my work. That's the work that in the KP Hawaii team. And then in the supporting equity space, they were very much focused, again, listening to community, really lifting up organizations that were rooted in the Native Hawaiian culture. And then also the Filipino community. I think it's 40% are Filipino in Lahaina. And so it was really important that that community was honored, that their voices were lifted, and that organizations that they already trust are the ones that we're investing in. They said to make sure I mention roots. So if you're here and you know who I'm talking about. And then in the mental health support space, there's a lot of immediate on-site mental health support, and then that's also part of the mid to long-term recovery strategy. Their other mid to long-term recovery strategy for Hawaii and for Maui is so mental health, housing, and then access to healthcare and food insecurity. That's what they're focusing on. I'm getting close. So for Southern California, I also spoke with my colleagues there, and they're just 7 months in on this one. And so, what they've done is they stood up a whole disaster response partnership in the Pasadena Convention Center. providing over 4,000 hours of volunteer time from our workforce. They also converted the Walnut Center Disaster Relief Hub into a place for community members, first responders to come, and they deployed mobile clinics throughout the fire areas. So far, they've invested just 6 million in the first 7 months, and they're focused on small business recovery, again, equity-centered efforts. So over 24 organizations that are those grassroots frontline organizations have received funding. And one of the things that they're really proud of that they wanted me to note is that they gave 4 million to that fire aid benefit concert, and it resulted in 100 million raised for the LA community. So that's another way we think we can partner, is being just a catalytic partner in recovery. So I'm almost out of time, my friends. I just wanted to share. So, for our national giving campaigns, this we do everywhere. So, in every KP footprint, anytime there's a huge need in community, we actually tap the power of our own workforce, and our individual employees are very committed to their own communities. And so, when there's a call to action, they will personally give. And you can see for the LA fires, over 1,200 people have given so far. In the Maui wildfire relief, I want to say it's closer to 9,000. So that those efforts continue and are underway. And I'll just end with this, that we feel strongly that the decisions that we make today in the rebuild can influence the health of the community tomorrow. And we always say at Kaiser Permanente, health happens outside the walls of our medical system. We know that 80% of what drives health outcomes is actually in community. And so it is so important that we listen to the wisdom of our elders, of our community influencers, our electeds, and really do respond to what the community needs in a meaningful way. So thank you for having me. It is a true honor to have been up here, and I'll share with you the contacts for the other service areas outside of Sonoma County. And then my team member, my colleague and community benefit lead in Sonoma County is here, Andrea Garcia. And so if you're interested in talking to her later, she's here, and I'd love to have you do that as well. So thank you.